We welcome you back to the Hilton Head News. Dr. John Kelemen is the Chief of Cardiovascular and Thoracic Surgery at Hilton Head Hospital. It's not quite as long a title as we've heard from some folks before. We're talking, though, about the COVID-19 crisis, the coronavirus, and maybe taking it down a step, further along. A couple of German studies, Dr. Kelemen, that have talked about what happens to people who even recover from the coronavirus, and they're not very encouraging. This is a mean virus even after you beat it, isn't it?
Yes, that's true. I think we're finding out it has more far-reaching effects than we first thought.
Talk about the German studies that have been reported recently.
Sure. There were two studies from Germany published in the Journal of the American Medical Association Cardiology section. The first journal looked at people who had died or passed away from coronavirus. Most of those people were in their 80s, and they studied their hearts to look at evidence of viral involvement in their hearts. And they found approximately 60% of patients had evidence of the virus involving or inflaming their heart.
Okay.
And the second study looked at people who actually survived. Actually, 2/3 of those people never were admitted to a hospital. Only 1/3 needed to go in the hospital. And a much younger group of people, about 45 years of age. And they looked at them 2.5 months after they recovered to see if there was evidence of heart involvement. And they looked at several different modalities. They actually did echocardiograms to look at their heart function and found that there was decreased heart function. They looked at cardiac enzymes to see if there was evidence of muscle cell death, and there was. And they did MRIs to look for evidence of inflammation, and there was. Now, these people were getting along pretty well, but they did have some functional level of impairment at that late stage in 71% of patients.
71%. Now that means, again, even if you contract it and beat it, as far as living through it, you're talking about danger down the road, long term, right?
I think it definitely raises some concern. We need more studies to determine what this means, but it is very concerning.
What precautions can people be taking above and beyond what we've discussed with washing hands and masking and the like?
Well, I think those are the principal precautions, social distancing, wearing a mask, and frequent hand washing. And then thinking about what activities you really need to be involved in and which are more elective and you could forgo.
When should you go see your doctor before you go get a test? Or should you, now that we have the option to get free testing, should you just continue to maybe do that on occasion? What do you suggest on the whole testing thing?
Well, I think being in contact with your physician is probably the most reasonable thing. And if they think you're particularly high risk, they may recommend more frequent testing. Otherwise, they may just recommend testing at the time of symptoms. But I think even more important than that is there are people with very serious medical conditions who are not seeking help for those. So people who have heart attacks, people who have other significant illnesses are not going to the emergency department or not going to see their doctor for scheduled appointments. And these illnesses may pose more risk than coronavirus.
So stay on your plan, right? Stay with your doctor, continue to get treated for what ails you normally, even outside of all of this, right?
Exactly. Yeah. And we're seeing that the hospitals and doctors' office have all put in place protocols which are protecting patients from spread while they seek medical care.
All right. Appreciate the time. I could certainly use a lot more of it discussing this because it is certainly at the top of mind for a lot of us. Dr. John Kelemen, Chief of Cardiovascular and Thoracic Surgery at Hilton Head Hospital. Thank you so much for joining us.
Thank you.
We also want to thank Pat Zuck, Sandy Gillis, and Steve Riley for their insights, and more importantly, we thank you for taking the time to check us out on the Hilton Head News. We'll be checking you out from a distance around our island home this week.